Hello and welcome to the video explainer for Polio Australia's Post Polio History Form. This is a two-page form that we're going to review now in context of the client or the patient, the person who has a history of polio and may be experiencing post-polio conditions, and also from the perspective of a clinician who has received this form from a client who has a history of post-polio, and they are treating them for the condition for which they have arrived, which may or may not be post-polio related. So this form has duality. We look at the side, the perspectives, the inputs, the detail required of the client who's filling out the form, and then we also have the perspectives from the clinical side, where we are trying to communicate and equip the clinician to understand and interpret the information that the client has provided on their post-polio. This form is post-polio specific. And what that means is that there's going to be a medical intake form or a medical history form that a clinical hospital will have. And that's a priority. Consider the post-polio history form as an accessory or secondary form related to this very specific part of the person's health history. Remember that this can be used for any condition. For example, the person may be coming in for knee replacement rehabilitation or to reduce their fall risk. They might be seeing a physiotherapist, or they may be admitted to a hospital with a severe case of the flu. It's not really important what the condition is. We just have to have this post-polio context when it comes to treating any condition. There are two parts to this video. Part one we're going to cover first, and that is looking from the perspective of the client. Part two, we're going to look at those parts of the form that are specific to the clinician. So let's move on to part one. If you take a look at this form, you can see that we've colored sections orange, blue, and green. The green is simply a space for a patient sticker or identifier at the top of the form on both sides. And in the orange is the client's related information, which is what we're going to talk about now for you, the polio survivor or the person who contracted polio, in the orange. And then the blue is what the clinician is going to kind of refer to and use as context and instruction for interviewing this in context of this form. As you can see on the left-hand side, page one, there are two sections in white. Those apply to both the clinician and to the client. One is just the instruction about the form, and down the bottom is just a link to resources. So we're going to move through the page one, top and bottom, and then page two, top and bottom. So looking at page one, you can see that there's a general details aspect above that dark line at the top. And there's a section that says post-polio diagnosis. Now, if you have received a specific diagnosis, for example, late effects of polio by your general practitioner, or if you have seen a neurologist or a rehabilitation specialist and they've given you a primary diagnosis of post-polio syndrome, you would write that in. We appreciate that not all of you have a diagnosis for post-polio, yet you know you have a clear history of polio from your childhood, but there's no specific diagnosis that you are aware of. This next section is information about how you came to visit this particular clinician, who sent you, who referred you, and then, of course, your general practitioner details, neurologist if you have one, allied health team if you have them. Obviously, it's only one line. This kind of form has not a lot of real estate on it for writing, but what you can do is just abbreviate. You might have occupational therapist, a ped orthist, or a orthotist, or a community nurse. Any that fit in there, just jot them down. You don't need to provide specific details. If the clinician wants those details, they will draw them out when they interview you. The caregiver advocate is really directed at, is there a person who advocates for you? For example, if you are admitted to a hospital and you're in a critical condition, who would that person be? Or is there a caregiver that helps you or guides you through health appointments and that kind of thing? Most likely it's going to be a spouse or a close family member. Put their name there. The next little section here is your acute polio history. Fairly general. We appreciate that not everyone can recall the details of their acute polio experience because many of you were below age 5. Most of you are below age 5. So the details that you do know, whether you recall it or whether you're informed of those details by a family member years after, put in what you can. I want to point out here at the percent recovery, you can either put a slash on that line to about what percent recovery you had from your acute polio before you became an adult, or you can write in a 30% or 70%. It's basically an estimate to give us an idea of how much recovery you had from that initial acute polio infection. And any details you have about iron lung use are also important to have. So on this bottom part of, on the bottom part of the first page, we have 3 sections here that are tick boxes. And so anything that applies to you, tick those as you go through. Just a reminder, as you go through this form, if there is something that does not apply to you, simply leave the line blank. This gives the clinicians a little bit of extra space to jot notes. And if you are discussing something or revealing something during the interview that isn't on the form, they can then add it to it. And it's not going to be as cluttered for them to read and understand. So you can see that there are quite a few things listed in the body areas affected. You can see the very second last one at the bottom, bulbar, has little asterisks, and bulbar is explained under the other section. There's also none of these, because some people who are affected by polio certainly caught the virus, but they didn't have distinct other symptoms or problems with these body areas. So it is entirely valid to tick none of these. Polio experiences, any of those things, particularly those who are hospitalized, may remember those things or have been told about those things. And just, again, tick those as you go through. If there's anything else, you can add it to the other line. And then in early rehabilitation, anything here that applies, certainly tick it. Just pointing out that hospital and home, some of you may have been hospitalized, some of you may have done rehabilitation at home. You can tick both boxes. When it comes to the Kenny method, that refers to the Sister Kenny method, which was developed in Queensland and then utilized in the US and Europe, that you may be aware that you received in your acute and rehabilitation phases of acute polio. Surgeries is also listed there. We have the examples of legs and spine. Those are the most common regions. You can be a bit more specific there. You might cross out legs and put ankles or knee or something more specific. And with surgeries for the spine, you might want to put down specifically what it was for. Was it a fusion? Was it a scoliosis? That kind of thing. Down the bottom, there's a few lines there to just describe your polio impairments from acute polio that kind of move with you through your lifespan there. So those things that didn't resolve, we want a bit more detail on those, so you can write that in that section. Let's move on to the next page. So this is the top of the second page, or the back of the form, and this side is now oriented to your post-polio condition. So page 1 was really a little bit of general history and clinical aspects at the top, and your acute polio history, this is all post-polio. Again, we've highlighted here in the red under where it says post-polio above the list, the single list, and it says, if not, leave blank. Just remember, if it doesn't apply to you, just leave it blank. So we have our currently affected by post-polio. This list may be a little different to what you had completed on the previous page. Remember, this is an identical list, but this is related to post-polio. So what you're experiencing in these body areas now. In this second part here, where we have symptoms and qualities, go through that list where we have how often, how intense, does it change, how often. You might put it occurs daily or every week or 2 times a week. anything that briefly states how often you experience that issue. How intense is it? You can write something like mild, moderate, severe, or you might use a scale 0 to 10 or 0 to 5. Just make sure you've noted what the number is. So if it is a 1 or a 2 out of what? Out of 5 or out of 10? Because those are two quite different levels of a symptom. And then does it change? A yes or a no is entirely valid to have in that zone. You don't have to add details, but you can describe those details to the clinician as they get through the interview with you. The last four down the bottom are more functional specific. So there's loss of balance, falling and fall injuries, work or fun is limited, and problems with exercise. We want to know how often do you have issues with those things? And then how do you feel about those? Because how you feel and cope with those gives us a few insights into your ability to function with confidence. So now let's move on to the next page, which is the bottom of page 2. And you can see that this now relates more to functional ability and independence and living arrangements. So the top section here, walking or wheeling all the way through to meal preparation. What you're writing here is describing any help you need from somebody or a device that you use to achieve those things in your normal day-to-day routine or normal day-to-day approach or strategy. Living arrangements, there is a line between width and levels and floors and width and stairs on the first two items under house and unit. You can put in a number there, or you can cross out or circle things that are relevant. For example, you may live in a house with 12 stairs. So you just have circle house, circle with, put a number in, stairs. Or a unit which is on the 4th level. So I'd circle unit and then circle 4th level. So a little bit of flexibility here. Just remember, this form isn't a formal research form. You have quite a bit of flexibility in how you provide answers on this form. So don't feel that you have to have a particular type of response. We're looking for what are you responding to and what information are you providing. The independence levels on the right-hand side, you can see the top 4 points go in a bit of a scale from no help needed through to routine full-time help or daily. And then down the bottom, who you live with. And if you have or drive a vehicle, you may have a vehicle, so you can just say I have and then cross out and drive and leave a vehicle. And then if you work part-time or full-time, circle part-time or full-time, it may be useful to actually write down what that work entails in that space or what type of work it is. The last two sections there are what post-polio goals you have and describing a typical day for you. Again, we want the basic gist of those things. We don't have to have great detail. So that brings us to the conclusion to the client side of the Post Polio History Form. That form is downloadable for free via our Post Polio Education Navigator. Go to that web page and you'll be able to find it under Resources. We're now going to move on to part 2, which is the explainer for the clinicians. So this is now part 2, explainer for clinicians receiving the form for client evaluation. We're going to look through both sides of the form. You can see here in terms of color coding, we left a green space at the top where a patient identifier sticker or something similar could be attached to the form. So when you're storing it in your documentation, the white sections on the first page, which provides a bit about the form, and down the bottom there's a QR code linking to our clinical or our education navigator page. The orange is what I've just gone over in the section 1 of this video, related to the person affected by polio who is filling out the form. The blue section is what we're going to focus on, kind of relating it to what we see in the orange section. We're going to go top of page 1, bottom of page 1, top of page 2, bottom of page 2 over the next few slides. So a few things about this form at the very top, post-polio diagnosis, the client may not have received a specific post-polio diagnosis, so they may have left that blank. But it may be worth investigating why that is the case if they know they have a positive, confirmed, or recalled history of polio infection during a polio epidemic. And that epidemic may have been in Australia, or that epidemic may have been overseas, and they may have immigrated to Australia. There's details then on the left side here, referral details, some information about who they're seeing in terms of allied health, medical specialist, GP, and then who their advocate or caregiver is, which is probably going to be their spouse or a family member. The next section is about acute polio history. The points on the blue on the right-hand side, those apply kind of one-to-one to each of those points on the left. And that's a unique part of this part of the form. The other clinical points that we go through are going to be a bit more general, but we're still related to the client side points you see on the left-hand side. Keep in mind the detail and the information in this blue side on the right here gives you some pertinent details related to why we're asking those questions. So that's a summary of page 1 at the top. Page 1 at the bottom of the page looks at acute polio. Now on the next page is all about their post-polio and their function. This is related to their acute polio experiences. So we have a list here that looks at the areas that may have been affected, and there are tick boxes that they can choose. I've also encouraged those that are filling out this form to consider it as a flexible form. This is not a form for research. It's not collated and there's not statistics driven off it. It's purely for communication between the client and the clinician. So they're going to write additional things here and there. They might cross things out. For example, instead of left leg, they may have left ankle or left knee as the body area affected. And of course, through the interview, you can draw out more information. Under acute polio experiences, these are some very common things that may have been experienced during their acute polio. So they may have been hospitalized initially, or they may have been kept home and seen a doctor locally. It just depends on the situation they were in. And then we have the early rehabilitation characteristics. So this could be, later in their hospitalization if they were severely affected, or it may have been in the years after where they were receiving rehabilitation, maybe in a community setting or at home. The last section there are looking at the long-term impairments that they may have adapted to or managed. So what have they carried through in terms of polio acute impairments that didn't resolve fully, that they have had through their lifespan? Now in the blue section you can see that we just need to make sure with the client that these are related to acute polio, not what they're experiencing right now. One of the unique things about this form is that it does touch on mental health and psychosocial aspects, not just physical aspects or condition symptom related aspects. There is an emphasis there which has previously not been emphasized or overtly addressed, but it is very important in the big picture care of these clients. So make sure you read through that section. Let's move on to the second page, back page, and the top. So here we have the post-polio body of areas affected, which is the exact same list that we saw on the previous page. You can actually fold over this top corner on a paper version, and it'll kind of line up 90 degrees to the other section about acute polio, so you can kind of quickly cross-reference that. There's also post-polio symptoms and qualities on this top section. So make sure you read through the clinical points. There's a few pointers about how often, how intense, and does it change. That's to help you align it with your practice and to maybe clarify things that you feel are more important. Remember, there should be spaces here on these lines where something doesn't apply to them. That gives you a little extra space to jot notes or add in information that they may have revealed that they did not actually include on their writing in the form. So, in the post-polio symptoms and qualities, the top section, the 2/3 of that, is related to symptoms or qualities that they may have And then the bottom third is related to more functional related things, which is loss of balance, falling and fall injuries, work and fun is limited, and problems with exercise. So we want to know how often, but also we want to know how do they feel about that. So this is a bit of an interpretation. It gives us a sense of how they are coping with those issues. And now on to the bottom of the second page, we're looking at functional levels. Just note in the top right here in the blue, which is in the middle of the blue section on the whole page, there are 3 post-polio specific measures that you can utilize in your assessment and evaluation, particularly if the person comes in with a primary complaint of post-polio progression. These may not be necessary to use if they're coming in for a knee replacement or a fall risk reduction experience with a clinician. So kind of use your clinician insights making that determination. You might notice that these items on the left are related to ADLs and to IADLs. There's a section on living arrangements and independence, and then post-polio goals and a typical day. On the right-hand side, you can see that there are a section there on educating your clients, health literacy in particular. Make sure you cover those points in any evaluation or at least by the second visit. So that brings the orientation to this form to a conclusion. The form is available for free download at the link you can see there on this page. And just be aware that there may be updates to this form in the future. So if you have used this and then some time before you have your next post-polio clients, make sure you duck back and check that form is available. Also good to know where it is stored and have a copy on file in case somebody comes in and reports a history of polio, but they were unaware of this form and the importance of sharing this information. That brings our video to a conclusion. If you have other questions about post-polio, you can certainly refer to Polio Australia's resources or contact Polio Australia at office@polioaustralia.com.au.